Hello everyone, welcome to Robust Lifestyle Channel. We bring to you health information that helps improve your life. So stay with us and enjoy. Today on Health is Wealth, we are looking at amniotic fluid embolism. What exactly is amniotic fluid embolism? Amniotic fluid embolism, also known as AFE, is a rare, sudden, and unexpected life-threatening birth complication that happens in pregnant women shortly before, during, or after delivery of a baby, and can affect both mother and baby. Its exact cause is not known. Amniotic fluid embolism can develop in otherwise healthy pregnant women during the second trimester, natural labor, cesarean section, or up to 48 hours after an abnormal vaginal delivery. In some cases, it happens after a woman has an abortion via an intrauterine injection or when trauma such as car accident or fall occurs. The exact cause of amniotic fluid embolism is not known. It occurs when some pregnant women have a severe allergic response to amniotic fluid mixing with their blood. Amniotic fluid entering the bloodstream is a normal part of the birthing process. In most people, it doesn't cause an allergic reaction. Researchers are not sure why some people react to amniotic fluid this way while others don't. Risk factors for AFE are hard to predict because it's rare and hard to study. However, current research points to a few possible risk factors such as advanced maternal age, being older than 35 during pregnancy, expecting multiples, twins, triplets, or more, fetal distress, changes to the fetal heart rate, issues with the placenta like placental abruption, preeclampsia or eclampsia, polyhydramnios, too much amniotic fluid, cervical tears, labor induction medications or procedures, having a C-section delivery, operative assisted deliveries, forceps delivery or vacuum extraction. Signs and symptoms of AFE develop suddenly and quickly. The symptoms are similar to other complications during childbirth such as uterine rupture, placental abruption, and eclampsia. This makes it more challenging to detect. Early signs and symptoms include shortness of breath or difficulty breathing, sudden drop in blood pressure, pulmonary edema, fluid in your lungs, abnormal heart rate, bleeding from your uterus, C-section incision or intravenous sites, fetal distress, agitation, confusion, sudden or increased anxiety, an impending sense of doom, nausea or vomiting, skin discoloration, chills. The early signs may lead to more serious complications including loss of consciousness, seizure, heart and lung failure, cardiac arrest, excessive and uncontrolled bleeding, disseminated intravascular coagulation, DIC, a type of blood clotting issue, stroke, acute respiratory distress syndrome, brain damage, death. Diagnosing amniotic fluid embolism is difficult because many of the symptoms can overlap with other serious medical conditions. Health providers rule out other possible causes while working to diagnose amniotic fluid embolism. Since AFE is a medical emergency, healthcare providers are always working quickly and are not able to rely on imaging or blood tests for a diagnosis. However, if one survives an amniotic fluid embolism, one's provider may order the following tests: electrocardiogram (EKG) to look at your heart's rhythm, pulse oximeter to check blood oxygen levels, chest x-ray to look for fluid around your heart, echocardiogram to look at how your heart functions. Treatment of AFE will need to happen very quickly to protect the mother and the fetus. The combination of treatments depends on which symptoms a woman has and may include immediate delivery of baby, giving CPR to help resuscitate an unconscious person, putting a person on a ventilator to help with breathing, using central venous catheters to deliver drugs, take blood, and give fluids, giving blood transfusion to make up for lost blood, giving medication to improve blood pressure, maintain the muscle tone of the uterus, and reduce the fluid that's built up around the heart or lungs, performing hysterectomy to stop the bleeding. Long-term effects seen will depend on the severity of AFE as well as the health history of the person. Effects from amniotic fluid embolism could be both physical and psychological. Some long-term effects could include neurological damage that affects your memory, permanent heart damage, complications from stroke if one had a stroke, kidney problems, anxiety, depression, and feelings of guilt, post-traumatic stress disorder, PTSD. The chances of a pregnant woman developing AFE is very low. Discuss your concerns about this rare condition with your care provider so they can help ease your worries. If you are an AFE survivor, you may have long-term physical or psychological side effects. Talk to your provider, partner, or friends for support in your recovery from AFE. If you love this, kindly subscribe to our channel, like, share and comment to help us bring you more on health issues.